Moving on, as COVID-19 cases surge in the UK, tougher lockdown restrictions are probably on the way. Much of England is already living under the toughest level of restrictions designed to stop the spread of the virus and protect the national healthcare system from a collapse. COVID-19 cases in Britain are at record levels, and the increase in numbers is fueled by a new and more transmissible variant of the virus. Britain has recorded over 54,990 new cases of the virus and has registered more than 75,000 deaths from the pandemic. In an interview, UK Prime Minister Boris Johnson said that restrictions might be about to get tougher, but there is a range of tougher measures that the government would have to consider. The opposition Labour Party leader Keir Starmer has said that Johnson must implement a national lockdown within the next 24 hours.
It may be that we need to do things in the next few weeks that will be tougher in many parts of the country. I'm fully reconciled to that.
Criticism has also been levelled at the government over its decision to push ahead with the reopening of many schools amid the spike. Due to the high caseload, primary schools in London will remain shut for 2 additional weeks while reopening across the rest of England begins on Monday. Johnson has, however, insisted that he has no doubt that schools are safe and has also urged parents to send their children back into the classroom where they can study. But some local councils and teachers have questioned the safety of this move and have called for a delay to be extended to these areas as well. UK has also become the first country to roll out the low-cost and easily transportable AstraZeneca and Oxford University COVID-19 vaccine. The Oxford-AstraZeneca vaccine is cheaper and can be stored at fridge temperatures, which also makes it easier to transport and use. The program will be expanded to hundreds of other British sites in the coming days, and the government hopes to deliver tens of millions of doses within months.
We hope that we'll be able to do tens of millions in the course of the next 3 months. I can certainly give you that figure.
Meanwhile, the UK's main union for doctors has warned that a lack of transparency from the government on when the vaccines will be delivered is causing major scheduling problems for the inoculation scheme. With many British hospitals at or near capacity, there are growing concerns over how the already stretched National Health Service will cope with an expected rise in patients. Field hospitals that were constructed in the early days of the pandemic and ones which were subsequently closed are being reactivated to tackle the current surge in infections. And our correspondent, Ollie Barrett, is joining us live from London for more on this. Thank you so much for joining us. The new variant led to tougher restrictions, and in fact, much of England is already under the toughest level of restrictions that there is. What new measures and curbs can we expect now?
So there are two things that we're looking at in terms of potential changes from the government when it comes to England. One is whether parts of England that are not yet in the toughest Tier 4 restrictions will be moved into Tier 4, and I think that is pretty inevitable in the coming 48 hours or so at some point. So that would mean in other parts of the country that essential retail would have to close, tougher restrictions on things like beauty salons and hairdressers, and the hospitality that is still allowed to be open, much of that would have to close as well. And then the speculation is whether the government might actually need to add another tougher tier on top. If the whole of the country moves into an effective de facto lockdown with all of it in Tier 4, and if that isn't considered to be enough to keep the current infection rate under control, then the government may have to look at tougher enforcement measures, as I say, some kind of Tier 5 or even Tier 6. But there isn't much more that the UK government can do in terms of locking down. Schools is clearly a key part of this. Many schools are already being delayed in terms of their return in January. Many are remaining shut because they're worried about safety themselves. So a difficult picture for the government to deal with. There are some extra measures they can put in place, but there aren't that many.
All right. Of course, as you know, there are concerns over children being sent to school. What can we expect on that front now?
Some children are returning to school this week. Others are seeing their start of term delayed. The real concern here is whether children spread the virus. All the way through this crisis, the government has said it would be a national priority to make sure that children were still in education, and that other things in other parts of the economy would have to close down to make sure that schools could stay open. But the government's always insisted, and even continues to insist now, that children are safe at school, as are teachers. The real worry now, though, is that if children are spreading this new variant at school, particularly at secondary schools, then that really makes it difficult to get transmission under control in the wider population and in the wider economy. So some schools are already closed and will be doing remote learning for the next couple of weeks at least. Others remain open, but it may well be that we see more school closures coming in the coming days.
And how do you think these restrictions will impact the ongoing immunization procedures in place?
The restrictions shouldn't impact the inoculation program at all. In fact, the priority now for the government is very much to vaccinate as many people as possible. Over 1 million people have already received the Pfizer-BioNTech jab in the UK. The Oxford-AstraZeneca jab is now being rolled out here in the UK as well, the first country in the world to get that jab into patients' arms. That is considered, according to the NHS today, a pivotal moment, because it is a jab that can be rolled out pretty quickly. It is cheap to store, to make, cheap to distribute, and so it's considered potentially a major turning point in the fight against the virus. But it's going to take some time to get it into all of the arms of all of the people that need it. AstraZeneca is saying that it still hopes it can provide as many as 2 million jabs a week to the UK. The UK is saying if it gets 2 million jabs a week, it should be able to get something like that into patients' arms over the coming weeks and months. If that is possible, then that brings forward the time when perhaps a return to normality in the UK is achievable, but it's a very high bar to hit.
All right, Ollie, thank you so much for joining us with all those details. We will continue to track this very closely.
Co-presented by Skoda. Simply clever.
WION is now available in your country. Download the app now. Get all the news on the move.